Hello, I'm Robert SIDONIO. I'm an associate professor of pediatrics at Children's Healthcare of Atlanta, and I've been asked to present the red hot topic for CODEROUGE. And the topic is going to be on hemophilia carrier nomenclature. You may remember that I previously presented a little bit on this topic a few years ago, pre-pandemic, seems like a long time ago. And as you remember, the impact of our care of hemophilia carriers is quite large. When you look at the overall numbers, it rivals the number of males with hemophilia, accounting for approximately 1.5 per person with hemophilia. We know, based on our research and based on a number of other researchers, such as Dr. Paula James, that hemophilia carriers have an increased bleeding tendency. This has been corroborated by a number of organizations with almost identical results. Most interesting recently, looking at the sheer numbers of patients in the United States, we see there are approximately 51 females with severe deficiency in the US, 80 females with moderate deficiency, and a surprising number, 1,541 females with mild deficiency. That's approximately 1 in 5 mild hemophiliacs being a female. To that end, we decided a few years ago, probably more than a few years now, that we wanted to improve the communication by proposing terminology, establishing a new nomenclature. There are a number of well-known investigators involved, including a number of prominent Canadians. The objective was straightforward. We wanted to propose a terminology and a conceptual framework for the categorization of carriers based on bleeding history and factor levels. And what we decided was that there were going to be a group of those with asymptomatic bleeding symptoms, and we should utilize that term in this manner, calling them asymptomatic hemophilia carriers. And they may sometimes in their lives develop bleeding symptoms, so opening up the options to be a symptomatic hemophilia carrier, remembering these are those that have normal levels. And we wanted to continue to call these patients hemophilia carriers, but when we're conducting medical care, we wanted to use a better term: women and girls with mild hemophilia, moderate hemophilia, and severe hemophilia. Hopefully this will ensure adequate care, timely care, and reduce the stigma that's associated with it. To that end, this paper was published recently. A number of people were involved and a number of organizations, including the ISTH SSC, when we really appreciate the endorsement that was given for this nomenclature. So what's next? Well, we still need a large registry, and it really needs to focus on a number of things listed here, including scores of bleeding, interim bleeding scores, joint range of motion, and all of the levels that are available. And obviously, we need to really create a network to study interventions based on specific bleeding symptoms. So I think in a similar approach that we have for von Willebrand's for this as well. There's an ISTH SSC Registry that's now enrolling. So if you can, please contribute. We have absolutely no money for it. So really relying on your kindness. And obviously, I could not have done this without a lot of people helping me along the way, a number of organizations, and a number of Canadian friends that have helped me along the way. So thank you very much. Have a wonderful meeting.